work with something you believe in, which is, for me at least, really important. I'm gonna try to show the best I can do the work we are doing in the office and the company, which is really important. Please, if you have any questions at any part of the presentation, please don't hesitate to ask anything, right? Just cut me and it's okay. We try to make a little conversation. I'm sorry, I don't know which is the dentist working in an office. Sorry, doctor, and you, right? Okay. Have you tried aligners first? Is this a question?
Yes.
Yes? Great. We're gonna try. You need to translate something. You can put with me.
Fine. Yeah.
This is okay for you?
Yeah, we're good.
Okay, good. Well, this little question is only to know which direction we need to follow for the whole presentation. Aligners is a new word, which means using a new aligner since they started in 1997, they try to follow a direction. The direction of efficiency, try to be better, try to improve themselves, try to expand the technique, try to have the market between the traditional and the new age of the orthodontics. So, talking about aligners, they are trying to get better at any time. So we need to talk about the efficiency, of course. They started a long time ago, but this study, for example, shows the efficiency they have in 2009. 2009. We can see the efficiency for each movement here in this study. More than 100 patients in this study. So this study shows the efficiency we can get with the aligner at that point, which means on average we can see the numbers, an average of 45% of efficiency. So they were trying to increase the level. And now in 2018, 1 year ago, a new, very respectful publication shows the new efficiency the aligners have today, which means they have an evolution from 45% of efficiency to an average of 75% efficiency, even 75%, which means for some movements they are doing really good, but for some different movements they are not quite good. For example, if we can see in this movement the intrusion of incisors, this is really difficult because they are trying to do the best, but the result is negative, which means the movement is trying to do from some way, but the result is doing the opposite, which is impressive because the aligners have a lot to improve even today. I'm saying the whole story of the efficiency of the aligners because, of course, the companies are trying to get some efficiency, trying to be speed, trying to use better biomechanics, trying to do some new technologies to improve the efficiency. But the traditional way is at the same point also. But making a comparison between different technologies, we need to say, of course, they are trying to achieve the same goal, trying to be better each time. But for aligners, what it means? Try to have new materials, new accessories, new tendency to protocols to get better each time. So in this case, we can do, of course, both, but with different ways. Which means aligners. Aligners is not when we talk about aligners, we are not saying only using a plastic, of course, but we need to use some different accessories to try to improve the efficiency and the speed, of course, which means button, elastics, cuts, chewing gums, and of course the attachments and mine screws. Attachments in the different forms. At the end, we are using different forms of attachments and adding one form to another to create an attachment. At the end, is this. Okay, this is now for us trying to lead or try to work with aligners with different accessories. But talking about acceleration, the last Congress I have the opportunity to participate. A lot of speakers are saying that they are worried about acceleration. There are even some little devices to try to get it faster with some treatments, even with aligner or conventional orthodontics. Which means in the market there are a lot of devices trying to get the treatment faster for aligners or any therapy in orthodontics. But what the studies are saying today? What are the publications until now? They are working very well. They are trying to do a best job, of course, but they are working actually really good. There are a difference between the normal conventional way of trying to use an accessory like this to get better. And unfortunately, a lot of studies were done. But this is the last publication we have today. And these devices, of course, are trying to get better, but the scientific article says that there is no difference until today about using it or not. Which means there is a different way to look for the acceleration. And it's very well known for the whole orthodontics. In this case, until now, nobody can say that there is any better than an nickel titanium archware to get faster. So, of course, if we apply a deflection and force, we can create a force to create movement. This is the first slide I want to talk to Geniova. The concept. Conventional way of orthodontics, of course, the properties they have: efficiency, move control, archware, the friction, the aligners therapy with a lot of course, better hygiene, removability, aesthetic, attachments, customization, etc. But Geniova is trying to look for something different, something hybrid, which means try to use the conventional properties plus the aligners properties in only one appliance. We're going to talk about brackets, we're going to talk about attachments, we're going to talk about removability, but the both technologies in only one place, which means Geniova. And to explain this, we're going to show this slide to make the concept. This is not Geniova is not a liner, but it's coded. It's coded. Any part is called a cap. Of course, inside there is a virtual bracket which is customized in the size and position. There is an archware in between, making a union between the whole attachments. And finally, of course, any component have a biomechanic consequence. The consequence, of course, of the caps are this differential anchorage, different power of movement. The bracket can vary in the size and position, which means different level of deflection of the wire. And when we talk about the wire, we need to talk about the sequence, a different sequence of archway, which means the concept of Geniova is not far away from aligners plus conventional orthodontics. What is exactly the way to create a Geniova, to make the fabrication, the manufacture? And of course, everything starts with the mouth of the patient, in this case the upper arch, which is scanned in the 3D STL file, and then we can add the braces, virtual braces inside, with different design. Even the attachment is in green. But thinking about our design is going to resolve this malocclusion. So, of course, the second part, this is only virtual. The second part, we're going to start sending this file to the 3D printing machine. Then thermoforming, and then the cutting of each part. Finally, adding an archwire, nickel archwire titanium. This is the cut design. This is the manufacture final process. And of course, at the end, we're going to put the Geniova aligner, hybrid Geniova aligner, inside the mouth. So, we have some brackets here. We have the archwire deflection for this patient in this side, because this patient is trying to expand these sizes. So this is the final appliance in mouth. So why is the reason then to try to do Geniova for this patient? We're going to talk about efficiency before, we talk about acceleration before, we talk about hybrid technology before. So we need to add the ideas at the end, because Geniova is trying to get an appliances and get a digital treatment plan to improve the aligner technique. We are not, again, this is important to know, we are not against the aligner technique. We are trying to trying to add some forces at the very initial stages to get better. So, the treatment planning, of course, digital. The Geniova treatment inside the design is digital. The manufacturer is digital. The whole digital workflow is working at the same time for aligners or the Geniova aligners, of course. And we are, in our cases, we are using, trying to use monitoring the treatment, dental monitoring, to control the patient for each week, trying to see the movements for research, etc. So, to try to finish this theoretical part, two studies were going to be shown. The first is crowding, the second is expansion. We're gonna see the result of each one of them. This preliminary study for crowding, we need to see the horizontal movements which were done for Geniova, adult subject looking for aesthetic, moderate to severe crowding, cooperative of course, and of course physical growth, congenital malformation were excluded. Only crowding for more than 3 millimeters were selected, and the teeth analyzed what was only the 1 millimeter of movement instead of 0.5. So the type of movement, protrusion or retrusion, the points of reference, in this case, the age of each incisor. So we collected after 32 patients, 100 teeth analyzed, in this case upper incisor at 28. The Geniova is usually used once per month. So in this case, was used once per month, only for 4 months of treatment, and this is what the planning, the software we use to make the superimposition at the end of the treatment. We use ortho laser with some points which are common from the starting point to the end. Finally, we get an effectivity of 86 and 81. This is the sample and the effectivity for each teeth, which is actually quite good. We are doing well, fortunately. We're happy to have these numbers. But we need to get compared. We need to get compared with some different treatment. We cannot say what we are the only one. And of course, we need to compare with conventional aligners. In this case, as a reference, we are having this late article talking about it, which is from 2008. The American Journal, of course, an orthodontics journal was this article. And we can say they both are doing quite well in effectivity. But this is important. The big, important, and interesting result was that our treatment duration was only 4 months, but the treatment with aligner was 12. Doing the same. The same movement, the same teeth, the same therapy with something removable. So this is the difference for us. This is actually very remarkable. 4 months against 12. Which means 4 appliances against 24 appliances. This is the big difference we have with conventional aligners. To start with. So this is the results, of course, the conclusion we have. And of course, the ash wire is working really well for these appliances because we are doing different movements. When we say movement, we need to only remember that in conventional orthodontics, we need soft and continuous movement. Soft and continue. Totally different way that the conventional aligner. This is the first case. This lady, of course, has the problem not in the upper side because it's quite good, but the lower. The lower is a moderate crowding, maybe severe, maybe moderate, of course. More than 3 millimeters of crowding was inside the study. Of course, this is the X-rays. The Geniova in place in the upper side. We, in the upper side, are trying to get some protrusion of these two incisors. And then, of course, we need to correct, of course, the rotation and everything. We use only one Geniova in 1 month, and we get this result. Please see the 2 upper incisors and see the difference after only 1 month. And then, at this point, we go for aligners. I've said that we are not against aligner. We're trying to help. So at the first place, we're using 1 aligners in this case and continue until the month number 4 to finish the case. So 1 month of Geniova and 3 months of aligner if the case is done. But the problem is the lower side. The lower side is actually really severe for aligners, but we need to ask how many aligners do we need for this case. Conventional aligners needs 29, according to this software. 29 aligners to resolve this crowding. But the question is, what happened with Geniova if we put 1 Geniova in the lower side? And the answer, this is the Geniova. You can see the deflection here using 1 group, different sizes of brackets, different design of course, and it's removable. Result, 2 months, 2 Geniovas, and we go from this to this, which means the protrusion of these 3 incisors. But in this case, it's completely different to start an aligner system since this first picture, since this started. So Finally, we use the Geniova face with 2 Geniovas and then continue with the liner with 4 more months until more number 6 and then finish the case, which means start with Geniova, helping the treatment and finishing with the liners. This is the help we're using. Of course, the time of treatment was reduced because at the first time we say 29 aligners, which means 14 months as an average. But we only use 6 and the case is done. Pictures, overbite, overjects, the class 1 is maintained, the stripping was done at the end in the lower side, the midline is corrected, etc. And the goal was achieved. The retention, of course, and the summary of Geniova, only 1 plus 8 aligners, 2 Geniova plus 12 aligners. And this is the summary of the case. We're gonna see now, faster, after the review of this case, about the results of different, this is a final record, there is a summary of some, but we actually saw the Geniova, the archway in the vestibular side, in the buccal side. But why do not use the same system, but in this case for lingual, to do the same? Which means the brackets in the lingual side or the palatal side, in this case the archway is doing, of course, in the palatal side, which is more aesthetics. And then with the same efficiency, we are doing actually the same movements. This is not different from the beginning Geniova for vestibular, but we are improving the aesthetic in this part. So this lady, of course, the problem you can see here is a negative torque in the incisor, but even worse, the position of 2 upper incisors and the 4 lower incisors in this case. We can say this is severe. This is actually severe. This is really hard to do with only aligners. But Geniova is trying to help again as a concept. This is part of the diagnosis because it was a lot of movement planified to do it. We can see the torque, initial torque of the lateral incisors, and we make analysis about the type of bone we have, if it's okay or not to try to get a lot of protrusion with the incisor, upper and lower. And we can say that more than 1 millimeter of bone is actually done for this case. Was actually good for this case. So this is only the setup, and in the setup we can see sorry. Do you have any question at this point about the whole I'm talking about?
Do you have
Sure.
Do you have a superimposed in the setup model?
Sure.
And
We,
finish
of every patient, and we usually do every 2 months. So we use 2 Geniovas, and at the end we have a superimposition of every 2 months, 2 Geniovas first, the superimposition, and then 2 more Geniovas, and then another superimposition. And of course, a superimposition from the beginning to 4 months. So we have the whole records until now.
And what was the reason that you switched to aligners after the first 2 Geniovas?
Because
Only aligners?
Sure, because the last control of torque, for example, tip and little rotation, they are definitely better with conventional aligners. Because we need only tight control, we can say that, and not for arch wire to finish the case. So that's the reason.
And there are a couple of concepts. I mean, what we are trying, the team here is trying to do is see what's the maximum you can do with Geniova, and then switch to aligners. So they're doing quite, everything that you can, and they are doing the clinical work to really understand that. In practice, when we first get started, I think from a big,
aligners. So after doing the program, the setup with the program, we have 22 aligners plus 23 aligners in the lower to achieve only this movement, only these 2 incisors and 4 incisors in the lower arch. So what happened with Geniova? With Geniova, we have different type of brackets, different design, and trying to help this treatment with conventional aligners. So this is the appliance, 1 month, 2 months, 3 months, using a compressed coil in this case, 4 months, and we have this. Finally, the result is as you can see this is the whole superimpositions doctor I was saying. We take pictures every month, plus superimpositions every 2 months. In this case, every 4 months. The superimposition is saying that we have moved 3.3 millimeters of plus 3.7 millimeters of these 2. This is not resolved, but we only used 4 Geniovas here, only 4 months to achieve it. So maybe we need to continue the case, but using aligners to finish it. But the whole treatment, the whole movement we've done in 4 months, this is actually the goal for Geniova. It's trying to help, trying to get better. So the treatment is in progress right now. The lower side actually the same. Compressed coil, 1 month. Compressed coil, 2nd month. You can see here in the 43 how was it the crowding here and how it's resolved until now. Only 2 Geniovas and only 2 months. A little bit worse in this side. We need another Geniova maybe, but this is only an evolution of this case. And how much movement we get? The whole numbers you can see, more than 2 millimeters down. And then, of course, we need to continue with aligners. But the goal was the patient was more confident, the movement was actually achieved in very short time with only few numbers of appliances, and it's actually better even for the impression of the patient. This is not the correction of overbite, of course. This is only a correction of overbite thanks to the inclination of the incisor, the pro-inclination of the incisors, and the patient is getting better only 4 months after a treatment. You can see the smile and the torque of incisors, which is a very good result for a patient to get confident for the treatment. The second, talking about the expansion, we can say the same. We've tried 4 appliances after 4 months, and our sample is only small. We are trying to increase the sample now, but the effectivity was actually quite good for Geniova. But we can say it's similar to conventional aligner. It's similar with Geniova. But again, when we say the differences is about 4 Geniovas against 28 appliances and 48 appliances in this case. There are 2 different articles. They are the 2 references, and against 4 months, 14 months, and 12 months. So this is the situation right now about the conventional aligners and the Geniova at the first stage, only at the first stage, because these articles are not showing the superimposition from the beginning to the end, but after 12 months in these cases. But with Geniova is only after 4 months. So this is the difference with Geniova. And we need to see what happened with the expansion. We're gonna show this presentation to this, which is better. Here is the same case. This is the case. We need, of course, a lot of expansion in this upper arch and the lower. We have some crowding here in the upper arch, in the lower arch. And then we have the X-rise, the different design. In this case, the bracket has actually, the whole is fully customized, which means a longer bracket, a shorter bracket, different distances, which means an arch wire which is deflected in the side we need to, which means expansion in this case. This is a standard arch wire, of course, was deflected and created some forces to achieve the expansion. And the results, after 1 month, 1 appliance, 2 months, 2 appliances, 4 months, 4 appliances, we can see the expansion here. And this is only an example. We have a few time. I could speak, for 5 or 6 hours about the same example from expansion. We're gonna see some. But this is finally an example, a very good example about what is Geniova doing for expansion. Last week, one big speaker in Spain was talking about the aligner, was saying that actually for aligner therapy, we ask 100% of times expansion for the cases, for the whole cases. So this is actually a really good appliance to do expansion as a Geniova side. We achieve more than 3 millimeters to the point of canine and the cuspids, more than 1.5 millimeters at the level of the gingival margin, which means it not only the torque movement, but the bodily movement also achieved in this case. And the lower side was actually the same. We asked for expansion here in these premolars. After 1 month, we have the progress. You can see here the line of the vestibular cuspids was achieved really good in this case, only for premolars. And then, of course, we go with incisors. And now there are different segments here. And then, of course, we did, thanks to the deflection, after 2 months, we continue doing it. And after 3 months, we have here. So we change to conventional aligners because it's quite good until now. So we need to have an exercise. It's totally different to have it, to start it here from conventional aligners to start from here. You know, the archway is actually with a very good shape in this side, which after the Geniova appliances. And finally, we go for conventional aligners. We can make a little exercise. This is the upper side. And of course, we have a setup. This setup, we said that we need 49 unconventional aligners to achieve it. After Geniova, for Geniova 4 months, we have here the result. So this is the final achievement of after Geniova. And then, of course, we ask for aligners. How many? 30. Which means we use 30 aligners plus 4 Geniova to achieve the same. So to reduce the time at the first place. So this is the exercise we're gonna do the same in the lower arch. So we're gonna have to start the setup with 47 aligners, but we use Geniova. What happened then? Then we need only 26 plus 3 Geniovas. Examples. Well, it's actually quite the same. As was said, protrusion, retrusion plus expansion. Another case of expansion, we're gonna try to be faster in this case. Expansion, the lateral segments, you can see here the expansion for vestibular. 3 months of Geniova, you can see the expansion of the upper arch, and then go for aligners, doing the reference, the measurements, 3 millimeters, more than 1.5 millimeters on the margin. Exercise, how many aligners? 32. After Geniova, thanks to Geniova, and then we go for aligner, how many? 14. Plus 3 Geniova. This is example. This is example. Okay? Reduce the time, reduce the treatment, reduce the aligner, try to get faster at the first place. And try to be more efficient. Remember the Gepard, I think it's in English, plus the car. It's actually the same, but we'll try to get faster with our technology. Another case, another expansion. Lower arch, you can see the compression here plus the crawling on the lower side and the upper side also. Geniova, 3 months, using it for segments, expansion, deflection of the wire. Then superimposition after Geniova treatment. Then the lower arch, expansion of these lateral sides. 1 month, expanded the premolars. 3 months, in this case, only getting some protrusion. Please see the difference between these two incisors. This is really difficult for aligners. This is really difficult for aligners. But with Geniova, a segment, a wire, stripping a little bit only to clean the contact point, 3 months. 1 month, only 2 months here. Result, the whole expansion we have, result is totally different to start from here for aligners. Just start from here. Nothing to see. Of course, we are using correct for our research patients. You have to see, of course, the same exercise 48 of normal conventional aligners, Geniova was trying to help, and in this case 28 only was needed, plus 3 Geniova in this case. We take pictures every month, we have superimposition every 2 or 3 or 4 months. This is our protocol, okay? So the same thing for the lower side, 39, Geniova is trying to help, in this case was really helpful, 21 alignment was needed, plus 3 Geniova in this case, so improvement, the same concept, okay? I can continue with the whole bunch of cases we have. Of course, we are using, I was said correct, it's actually a very good partner, a very great technology to complete the treatments, and this of course involved outside our research. Another patient, another expansion and protrusion, the different designs we can see here. In this case, it's expansion plus protrusion of the incisors. Expansion plus protrusion of the incisors. 3 months. Then aligner. Exercise 42. Thanks to Geniova, it was reduced to 28 plus 3 Geniova. This is the software, okay? And I need to say something which is really important, and it's a little bit controversial. We are saying that thanks to the 42 aligners, we need to achieve the goal. But the first slide I've shown to you was only the efficiency of 75%. 75, which means it definitely would be done, is only 42. And we know that. We need the refinement. We need the second refinement. In some cases, we need the fourth refinement. Then we have 42, of course, but could be worse. Could be even with more aligners, okay? So Geniova again is trying to help for these cases. Lower side, you can see the appliance, use it here for expansion and protrusion of the teeth. The same exercise, 34 against 17 aligner plus 3 Geniova, trying to reduce the time. The lingual appliance, as I was taught, was used for some cases also. In this case was expansion, and of course in this case protrusion of the incisors. You can see after 2 months the results, plus 3rd month of the lower side, trying to do some protrusion of the lateral incisors, cutting in these parts, anchorage in these parts, differential forces. Result here, from here. The concept was clear. Geniova is trying to help to align. This was the evolution of the aligners. If you want to see some different numbers, of course, it was 36, different from using 18 plus 2 Geniovas. The concept was actually until now, at least, clear to use the Geniova for expansion, getting some protrusion, in this case 26, but after 3 Geniovas, it was only achieved for 9 according to the software. Because you can see the result. It's almost done. It's almost done.
Also, I think, all of you practicing in the clinic now, if the patient doesn't see results in the early stages, the cooperation in wearing aligners kind of starts going down. And this is also one of the big factors, to get a really nice first, stage of quick movement, they are a lot more cooperative with the end result, to wear the aligners and get the final results.
I'm gonna watch this.
Do you want to tour a little bit,
Yes.
see how we
Yes.
because living?
I think we don't need to see too many more cases. Maybe you have some for space closing, right?
Yeah.
Can you just show that one case or 2 cases?
Sure.
And I think we can finish there. We don't need to look at class correction. I think you had that one with the diastema. Maybe just that one might be good. Yeah.
For example, this is only really fast case. We can see the whole diastema we have with this patient. This is now in treatment. This is only to show the dental monitor. But according to the setup, of course, you have a space here, the middle, and this shift. the lower side is to the right, so we need to correct that, and we need to achieve the movement to this mesial side, right? The 4 quadrant to get mesial. So this was the setup. First, try to make the laterals to mesial, and then unit the 3 to get to mesial. And this is the coil compress we use for trying to improve the spaces quickly. And you can see the result first. Only one appliance was done, and after 2 weeks, and then we use another Geniova because we have the group here of 3 aligners, the coil in different way. We could use lingual. We see the result here, and after that we just have a different group with a new coil here. You can see this is only the evolution of the case. This is one patient we was using dental monitoring. With dental monitoring, the whole movement we can achieve that more than 1 millimeter per month. But this is the case. For example, with this big diastema, which is actually good to show because we need to close this space to final implant treatment. So there's wire, the coil compress. This is only biomechanics trying to push the wire to back and then close this space, but quickly. 1 month is not closed. 1 to 5 months is closed. And then go for a liner because we need to correct the rotation as the person said, our friend. This is the conventional treatment with a space management with Geniova with only 1 appliances, 1.5 months done here, and then go with the liner.
You can imagine if you want to do IPR, like let's say right in the beginning, and you want to consolidate all that space, you can also use the same technique, like use a coil, gain all the space in like 1 month or so, and then you can correct your severe crowding quite quickly because you don't have to move teeth one by one. Yeah.
Finally, only 2 slides. You can see the whole diastema the patient had. The smile is actually the problem for her, and we need to achieve 1 movement. Set up, close the spaces, and go for veneers. And in this case, we have only 1 Geniova for this movement. It was achieved 1 month, not fully. 2 months, try to go with the laterals, and 3 months until now, and go for aligners in this case to complete a little bit the correction of the rotation, and then go for aligner. This is only the 3 months treatment of Geniova managing this patient. I need to finish to that, of course, but the whole superimposition after 1, 2, and 3 months went done. The whole movement on each teeth was actually really good for us. More than 1 millimeter, we can say. How much? It was an average of 1 millimeter for expansion, 1 millimeter for anterior posterior correction, and 1 millimeter per specimen. I think for now it's okay. And thank you for the attention. It was a pleasure. You need to ask please something. It would be
Patient.
how many hours?
How many hours? Yeah.
How many hours? We usually say they can eat and then rest a little bit, which means we usually recommend only 3 hours of rest or 4 hours to rest per day, which means eating and then they can rest an hour, for example, after eating. This is the only suggestion we have, but we have not made any study about it. So in some patients, with aligners, you say the patient usually, you have to use the whole day, but they use a few hours less. So if with this appliance, could be less? Yes, could be less. But we usually say they can rest 3 or 4 hours per day, and this is the result. That's it. Okay?
Yeah.
One question.
Sure.
When you cut the aligner, how much do you cut? In how do you measure the length?
The length of the
aligner cutting.
Well, it's actually it's pragmatic, which means in the cutting, this is usually in the crowding problem, right? Bindu, you are going to say something?
Maybe what we can do is, I think people might leave for the day.
Yeah, because people
so maybe shall we go do a visit and then